ক্যান্সার চিকিৎসায় দীর্ঘকাল ধরে বিজ্ঞানীরা বহু পরীক্ষা নিরীক্ষা করে আসছেন, আবিষ্কার করছেন নিত্য নতুন চিকিৎসা পদ্ধতি। সার্জারি, রেডিয়েশন থেরাপি, কেমোথেরাপি এবং ইমিউনোথেরাপির পর ক্যান্সার চিকিৎসায় সবশেষ সংযোজন প্রোটন থেরাপি।
Proton therapy is actually a form of radiation. The most traditional form of radiation treatment is the photon treatment or X-ray treatment. This in physics term is actually an electromagnetic waves. They do not carry any charge. They are quite similar to X-rays, but they are more powerful. This is your traditional photon X-ray. Proton therapy, because of this physical nature, it can be programmed to release its energy where the cancer is, has some advantages. For example, cancers that are very deep in the body, such as brain tumors, tumors of the head and neck, prostate cancers, is actually very useful for the treatment of children with cancers actually. I think proton therapy is actually most useful in the treatment of childhood cancers. As we know, for children, most of their organs and tissues are still growing. So any form of radiation will affect the growth of all these tissues. So if we treat a child with cancer, it is most important to reduce the dose of radiation to tissues which do not contain cancer. Side effects of proton therapy is quite similar to the radiation treatment of any other tissues. This will depend on the area of treatment. For example, a sore throat, the skin may become burnt, mouth becomes very dry. Proton therapy, because the machines that are required to produce the proton beam is actually physically in size and technology is a lot bigger than the X-ray machine. So proton therapy does come with a cost because the equipment is expensive. It can be up to 5 times or 10 times more than how much X-ray radiotherapy machine can cost. So proton therapy is more expensive. This cost is not affordable to low-income countries. I think if we look at the cost of the machine itself, it can range from US 25 million or more just for a machine itself, just for a proton therapy machine itself. Bangladesh is a country with a big population. I think, and its population is also growing. I think the cancer needs for the people is quite high. I think the need to provide basic or even slightly more advanced oncological care in terms of radiation therapy. So there are machines, usually the basic radiation therapy machines, which are actually needed to treat this big load of patients. So I think that is the first requirement to fulfill. Proton therapy, like I mentioned, is used more for certain cancers, but it can be used to treat quite a lot of cancers. And because proton therapy is relatively new compared to conventional treatment, and it's expensive for patients to go through, so I think many patients actually go to proton centers for proton treatment. So I think in the last 20 years, there is not a lot of medical data coming out from proton therapy. But if you look at some of this data, you can see that in terms of cure rates, it's quite similar to conventional X-ray therapy. But if you look at side effects, especially long-term side effects, there is a reduction in the side effects.